Hi, I'm Marissa Schaefer.
And I'm Jenna Cantor, and welcome to Physiotherapy Performance Perspectives, a physical therapy podcast for performing artists.
Today we are on the phone and welcome Dr. Annette Karim, who's calling us from California. Hi.
Hello.
Hello, welcome.
Thank you. I'm glad to be here.
Glad to have you. Dr. Karim is a board-certified orthopedic clinical specialist, as well as a fellow of the American Academy of Orthopedic Manual Physical Therapy. She received her doctorate in physical therapy from Texas Women's University. She's taught ballet, pointe, jazz, and tap for over 25 years in California and Texas, and was the dance director for Break the Barriers and the Houston Metropolitan Dance Company's Met 2. Prior to moving to Pasadena, Annette was the on-call physical therapist for the Houston Metropolitan Dance Company and provided backstage PT for traveling Broadway shows. Annette's experience with students and other professionals drive her passion for dancer and performing artist wellness. She is an active member of the American Physical Therapy Association's Orthopaedic Section and serves as the current president for the Performing Arts Special Interest Group. Additionally, she's a member of the International Association for Dance Medicine and Science, the American Academy of Orthopedic Manual Physical Therapists, and the Taskforce for Dancer Health, Dance USA.
Dr. Annette Karim is here today to talk to us about a relatively common injury seen in dance, hamstring strains.
Yes. So for those of us who don't know, we wanted to ask you off the bat where on your body your hamstring muscles are and what their function is.
Okay. Well, there's 4 parts to a hamstring. 3 parts start on your sits bones or your ischial tuberosity, and they attach to either the middle side of your lower leg or on the outside of your lower leg. And then one part starts on your femur or your thigh bone, and it attaches to the lateral side of your lower leg. The muscle serves to work as a hip extender or a knee flexor. It's innervated by what we call the sciatic nerve. A sciatic nerve branches off into a tibial nerve and into a peroneal nerve, and those both come off of that sciatic nerve. And so most often we feel a hamstring strain, and we have to distinguish between a nervy type of injury or a muscle type of injury.
Just to clarify, when you're saying these muscles and then you're saying a nerve, what does the nerve actually do to the muscle?
Okay, the nerve acts to provide it motor ability, like the ability to be activated, and then it also provides sensory information to your brain through your spinal cord to tell you what the muscle is actually doing.
Great, thank you. All right, now would you mind clarifying what is a strain?
Okay, well, a strain is what we usually call a muscle pull. It's any time that, like your tissue, specifically in this case, our muscle tissue goes beyond that zone of elastic, bounce to and back, and into this what we call a plastic region. That's when the tissues start to change and they don't really bounce back very well. And at some point, you could even have tissue failure during a strain. Shall I go on about the type of grade of strains that we have?
Absolutely.
Okay. Well, early on in that plastic region, you might have a grade 1 strain where you feel the muscle pull and you feel it every time you dance. And whenever you're at the end range of a muscle contraction or a muscle length, and not necessarily during your walking, but you'll test strong during the muscle test with very little pain. And usually it's about 5% of muscle overstretching that has happened. It usually happens at the end of like a fast running and really at the top of the tendon, closer to your bottom. And for dancers, that happens like during prances or sissons or jeté, dégagé, frappé, any kind of dance movement that involves knee extension and hip flexion, but at a smaller degree. For grade 2, you might feel that with walking. You'll test weaker on that side and you'll feel pain. It's considered grade 2 up to a partial tear. Anything beyond that 5% up to a partial tear of the hamstring. It happens during kicking, like with a battement, or when you excessively lengthen that muscle at the ischial tuberosity, again at your sits bone. And that's at a larger degree of hip flexion and knee extension. So it could be either with the hip flex and then you extend your knee, or it could be with the knee extended and you flex your hip. And then grade 3 is like anything beyond that, up to completely rupturing the muscle, or even fracturing the ischial tuberosity with the muscle rupture.
Ooh, grade 3. Does not sound friendly. Dr. Karim, we were wondering if there are certain traits that make someone more likely to get a hamstring strain, like decreased flexibility or strength.
Yeah. Actually, lack of flexibility from a muscle being short or being on all the time, and feeling tight, right, can also be a risk factor, or even over-lengthened muscles. Muscles that are too long can be risk factors. I'll go into detail about that in a second, but I wanted to mention some of the other risk factors involved, like fatigue, because they found that, like, when you're tired and your muscles fatigue, you actually take in a lot more energy into the tissue, and it can be affected in that way. When there's strength imbalances, like the quad hamstring or the glute versus hamstring, or side-to-side differences between hamstrings, insufficient warm-up, like not being warmed up and just dancing cold, do a big bop-ma and you're cold, or having a back injury or associated neural tissue tension, and all of those things can be changed. Risk factors that are not changeable are things like muscle composition, the age over 23. Back to muscle composition, it's usually the fast twitch that is the issue. Race, and then history of prior hamstring injuries.
Dr. Karim, would you mind defining what a type 2 muscle fiber is?
Sure. A type 2 muscle fiber is a fast-twitching muscle fiber versus a type 1 is a slow-twitching muscle fiber. And so people with a type 2 fast twitch, I mean, you can imagine those are your quick jumpers, right? Those are going to be people whose muscles go quick, like a runner, instead of like a marathoner, it would be someone who's running like a relay race. And in dancers, that'd be who needed to jump quite a bit or leap a lot. Those are people who, are the quick folks in dance. Okay, so back to traits that make someone likely to get a hamstring strain. In terms of flexibility, we have to be really careful to define the difference between short, tight, and stiff muscles. I remember being a dancer and sitting in the splits forever, and then that was really part of class too. And we wouldn't be able to get up and walk afterward. Everyone can identify with that.
Yeah, definitely.
So it's short muscles. Short muscles lack length. So even when the muscle is totally relaxed, that muscle's short. And that kind of muscle would benefit from stretching. If you stretch a short muscle, you're actually causing tissue remodeling in response to the tissue demand. So a muscle with decreased flexibility can increase the knee flexion torque, what you fight against to create, like if you straighten your knee and your knee is bent because your muscle's too short, then you have to fight against that, and that could cause injury. In terms of resisting against that torque. So you can strain that hamstring during knee extension with the hip flexed, or hip flexion with the knee extended. For instance, during a kick, a bop-ma, a bande, a soda shot, a leg hold turn, illusion. And then on the other hand, a tight muscle is often one that's overworking, or it's on all the time. It's on, ready to go. That muscle needs to learn how to relax. It doesn't really need to be stretched. Usually it's the eccentric contraction because it's on all the time, or a lengthening contraction, or some kind of contraction during a stretch of that hamstring that's the primary reason for the strain. In this case, that on all the time muscle really needs to simmer down. That tonicity, or the high tone of the muscle, is too great, and it's not balanced with the other muscle groups in terms of firing patterns and what we call agonist-antagonist relationships, like quad versus hamstring. So stretching a tight muscle, usually this kind of muscle, tighten up more as a response because it wants to be on and it wants to respond. So it can also contribute to that knee flexion torque. And then as far as overstretched dancers, we have to be careful not to let dancers sit in their splits all the time. Overstretching a stretchy dancer is a really big problem in dance culture. An overstretched tissue is already at the end of the elastic zone, and it might be already into the plastic zone. So in the case of a super flexible dancer who feels like he or she needs to stretch a tight feeling muscle, what you actually need to do with the overstretchy dancer is to make it more stiff or increase its springiness. The feeling that you need to stretch is your hamstring telling you that it's too stretched and it's trying to pull back to normal length. Remember, if it's too long, there's nothing to call on when you need the muscle strength. Mm-hmm. So muscle stiffness is totally different than tightness. Stiffness is the ability to bounce back. So the lack of the ability to bounce back puts that overstretched muscle in a really dangerous place, closer to that fail point in the plastic zone.
Thank you. That's such great specificity for any dancers listening in, and they might be able to relate with some things, or they can identify some significant things for their own personal health. So now moving on, how long do you think it would take to rehab a grade 1, grade 2, and grade 3 strain?
Yeah, so I actually went back to look up the most current literature because, I have old books and then I've got to always keep up with the evidence. Usually 1 to 4 weeks for a grade 1, 2 to 5 for a grade 2, and 3 weeks to up to 5 months for a grade 3. There are even some grade 3s that take up to a year to heal. So depending on the severity of that grade 3.
Wow. And with grade 3, if there's like an avulsion or if they need perhaps any surgery, is that included in that up to 1 year time frame?
It is.
It is. Great.
Okay.
So you alluded to this a little bit before. You said some of your dance movements might be a little affected by hamstring strains. Can you go back and reiterate what kind of movements might be limited with individuals who have hamstring strains?
Sure. It depends on the severity of the strain, but like split, kicks, leaps, développé en avant, leg holds, like when people do leg hold turns, even fouettes, battements, illusion, anything that involves hip flexion with knee extension or, knee extension during in a hip flexed position.
Cool. Thank you.
Yeah, I wish I could cover more of the tap thing. I guess, I just about anything that creates that knee extension with the hip flexion.
Yeah, it's going to cause
good.
strain. Mm-hmm.
It's very clear. Mm-hmm. So what are some general components of hamstring strain rehab?
Okay. Well, there's 3 phases of rehabbing hamstring strains. In the first phase, right at the beginning, you want to control the inflammation and swelling. So that's going to be the first thing that you do. And then you're going to want to do low to moderate intensity trunk or core stabilization and some overall agility. You got to keep moving. I mean, motion is motion. Your body.
Like that.
You're going to do small range exercises and no isolated resistance training or stretching of the hamstring. In phase 2, you can move on to that phase if you can jog slowly without pain and you can resist muscle testing at about half to 70% resistance in that laying on your stomach position with your knee bent at 90 degrees. That's usually a PT does that testing on you. You start to increase, in phase 2, you start to increase your hamstring range and your length, but you don't do any end range holding, especially if you're still weak. And you're going to ice as needed after rehab. You want to increase your intensity and speed of the demand in your exercises and address neuromuscular control, agility, and trunk stabilization. And toward the end of phase 2, you can start eccentric training. In phase 3, you move on to that phase when you can do one full max contraction with your knee bent at 90 degrees. So that's your PT is like yanking really as hard as they can and you're doing fine without pain. And you can jog front and back at 50% of your fastest speed without pain. You progress at that point to advanced exercises in eccentric training, dance-specific exercises, and there's no activity restriction. You can do contractions at end range at that point.
Nice. Just to clarify, can you tell us the difference between a concentric and an eccentric contraction of a muscle?
Absolutely. So concentric contraction is when the muscle is shortening and you're required to use the muscle to activate that muscle. Eccentric is when you're using that muscle in a lengthening movement or position. So it would be like my hamstring, like I'm squeezing my knee and trying to flex my knee while extending my hip, or that would be eccentric. And then, sorry, let me back up.
Okay.
So, like, say I'm if I'm doing a concentric, it would be like bending my knee and squeezing a ball towards my hip, right? Mm-hmm. Or doing eccentric, it would be extending my knee. Is it going into extension, trying to create it? I'm trying to make it bend.
Gotcha.
Or concentric would be like if I'm moving into arabesque, or if I'm trying to lift my leg backward into extension, that would be concentric. And then eccentric would be, say, my leg is on the floor and I'm bending forward and I'm trying to balance myself on like a heel stand.
Huh, cool. Yeah, that makes sense to me.
That's great.
Thank you. So I think you mentioned this before, but if I've had a hamstring strain, am I more likely to get one again? And if so, why?
Okay. Well, yes, you would be likely to get one again for the same muscle. So if you had a hamstring strain, you would get it again for the hamstring. Partly because of tissue remodeling. So you do remodel your tissues again, but you do sometimes have some scar tissue around the site of injury. And it does affect, like, even your sciatic nerve gets affected in that area and can change the way your muscles fire. The other one is your brain has adjusted to a new image of your body. And so some of your rehab needs to include your brain's understanding of your injury and your leg. And then the last one would be taking care of the root cause of why it happened in the first place. So if that's not addressed, then you're just putting a Band-Aid on the issue and making, that current issue better, but you're not taking care of the reason why it got that way in the first place.
Thank you. Dr. Karim, is there anything I can do to decrease my likelihood of sustaining a hamstring strain?
Okay, so if you're over-flexible, you want to increase your muscle stiffness. Stop sitting in your splits. And those are people who have, you're extremely hypermobile, your skin is really stretchy. You definitely want to increase the tone of your muscles. In terms of warm-up, you want to do dynamic whole chain or whole body exercises and warm-up, especially if you're feeling that tightness. You want to make sure you get enough sleep, overwork your body. I mean, it's okay to take a break. And do something different. Rest is a great thing to do. I know it's a really hard thing to do for dancers because, like, on our vacations, what do? We take intensive. Mm-hmm. Or maybe summertime we take 2 or 3 intensives. So it's actually a good thing to take a break. Take a whole week off. Make sure you get enough rest, overdue, and say, okay, I'm not dancing, but I'm going to go do CrossFit or I'm going to go run a marathon. You need to listen to your body. And then I think it'd be good to see a physical therapist who understands dancers, demands dancers have, as well as dance movement, so they understand what you're going to still need to be able to do. That way you can address your risk factors and keep on dancing.
Great. That was super clear. It's so important. I feel like we've heard this multiple times before, to take a break. You're right. It's very ingrained in our culture not to.
Oh, absolutely.
Yeah. So for our last question, thank you for enlightening us on hamstring strains. We wanted to ask you to tell us about your favorite story of treating a dancer.
Wow. Okay. Well, I had a dancer with a hamstring strain, so I thought I would talk about the hamstring strain.
Perfect.
But, I can tell you many favorite stories because I just love treating dancers. That's all I do when I'm in the clinic is I work with dancers all day, all night, all my emails. I just love dancers.
Nice.
So my dancer with the hamstring issue had chronic recurring hamstring issues, and when she saw me, she had a history of a partial hamstring tear. at the proximal hamstring. But what was really interesting about her was that even after the hamstring tear was healed, she still had pain with her, like with bop and with développé en avant, with stretching forward, like cambre forward. That was really painful. And she had to go audition for a college dance program. And so what was really interesting was that thing I alluded to at the beginning with the sciatic nerve and the branches of the sciatic nerve, because she had neural tissue tension. So I guess the proximal hamstring tear did affect that sciatic nerve closer to the ischial tuberosity. And so what ended up happening is I tested her for adverse neural tissue tension, and she had a positive slump test. And by treating her neural tissue tension, I took away all of her pain, and she was able to do all dance movements without any problem, and able to go on to her audition, and she's in college in a dance program.
Ah, congratulations.
That's absolutely, how rewarding. That's great.
Thank you for sharing. And thank you, Dr. Karim, for joining us today. We really appreciate it.
Great. Thank you. I appreciate you giving me a call on this.
Of course. And thank you, as always, to our listeners for joining us for another episode of Physiotherapy Performance Perspectives. Join us on the first Monday of every month for the next episode.
To hear more of our episodes, click on the link in the description below to view our website. Like us on Facebook at facebook.com/PT Performance Perspectives to stay informed. And finally, if you want to get in touch, email us at ptperformanceperspectives@gmail.com. Thank you so much. Bye.